taking time for me. Can't nobody grind for me. The hardest blow won't ever take me down. Yeah. The strongest thief won't ever take my crown. Yeah. Held down for so many for so long. But now I'm taking time for me. Can't nobody grind for me.
Good afternoon. How's everybody doing? All right. I'd like to thank you, the LSU and the diversity office for allowing me to come back to Shreveport to share my story. All right. Let's see. So when I was trying to decide of what I should, speak about and the demographics or who I was going to be speaking to, it reminded me of when I was interviewing for residency. For orthopedics, for those who don't know, you apply to and go to medical school, and then you have to apply for the different specialties that you are interested in. For me, it was orthopedics, and I was at Harvard, Cleveland Clinic, Baylor, Stanford, to name a few places. And I was just amazed that the people at the interview, the interviewers, who are very accomplished and have lots of accolades, and they were really inspired by kind of my story. And I was like, wow, a kid from Shreveport, Louisiana, who sitting here at Harvard interviewing for orthopedic residency. And they were pretty impressed with my story. So when I left those interviews, I did two things, because I think it's important for people to see someone who looks just like them, who talks like them, who comes from a similar background. So the first thing I did was I wrote a book called Overcoming the Odds, and I wrote it about my time kind of growing up here in Shreveport. I wanted it to be a book that a kid can pick up and can use as a guide to get through life. And I talk about all the mistakes, everything that I learned along this path, and some advice. I give advice after each chapter. Another thing that I did was I started a blog. As you can see, this was in 2010 here. While in medical school, I wanted a place for my family to follow my journey, just to talk about some of the things that we were doing in med school. And this became pretty popular, and I got a lot of questions from this from like all over the US. So due to the fact that I was getting all these questions and they were pretty similar, I thought it was probably no better idea to put this into video. So I started a YouTube channel about a couple years ago, and I wanted it to be a way for people from a similar background as myself to, see someone who looks like them and very successful career. So we have passed almost 15 million views over the last few years, 135,000 subscribers, about 500 videos about my path, what questions the students should know, and what things they should know, what tests they should take. And I interviewed deans of medical schools to get their perspective. What should the students know before applying to medical school? I feature different anesthesiologists, different specialties. This anesthesiologist here is from New York, and she just shows the viewers what it's like to be an anesthesiologist. And this was really, something that inspiring for me to see that video, just because I didn't know any black doctors growing up. I didn't know any doctors at all, and no one in my family is a doctor. So that's why it was important for me to start a series. It's called Careers in Medicine. I've interviewed about 80 healthcare professionals, veterinarians, physical therapists, OFMS, dental hygienists, neurosurgeons, because there's a lot of specialties out there, a lot of jobs that people just don't know about, and you don't know about it unless someone mentions that to you. This is a doctor, he's a general surgery resident and took a year off to work at Grey's Anatomy he's one of the real doctors, he's not one of the actors. I didn't know that was, something that was a possibility. A pediatric dentist, this radiologist here works from home. Can you imagine just being at home all day and getting paid? That's crazy. A neurosurgeon here who has 3-4 kids. A lot of women that approach and ask questions. Hey, is it possible to raise a family while being a busy surgeon? And yes, that she shows that this is possible. So this has become really popular, not only here in the US, but all over the world. I get emails from Brazil, Iraq, France, Australia, Africa, Bangladesh, about people watching the videos and hear my story and are inspired by it. And this is Finland and Spain. This is kind of a breakdown of where the viewers, all these countries here that are watching the videos. So, I challenge healthcare professionals, if you're in some form of leadership or if you, any career professional, to get out there, show your face, because a little kid like me from Louisiana who didn't really know any black doctors growing up or nobody in my family, this would have been a pivotal point in my kind of life here. So if I would have had this when I was growing up. But about me, I'm from Shreveport, Louisiana. I went to Hollywood Middle School. My principal from middle school was just here this morning for the 9 a.m. talk. And I told the story about how he paddled me in middle school for getting in trouble. I don't think you can do that anymore these days. And he kept me out of line. And when people got into different arguments or wanting to fight in school, he used to take us to the little room, put boxing gloves on, and let us duke it out. So these days, people are pulling out guns and pulling out guns really quick. So I think that's definitely a change from the atmosphere these days. I went to Southwood High School, was an undergraduate, and then the Fairpark Medical Careers Magnet program. And this program got me interested in medicine. It's the reason why I'm a doctor today. I never was the perfect kid. Don't let this picture fool you here. I was getting into a lot of trouble, started hanging around the wrong crowd. The people that I looked up to were the drug dealers here in town. We call them the dope boys, or people that had all the money, the nicest cars, big rims, and I started making decisions that were irrational and, just because I wanted to be something similar to that. That's why I think it's really important to have representation, people that look like you, this radiation oncologist or a plastic surgeon or a flight surgeon. That way kids from communities similar to mine can see this and be like, wow, I want to do that too. Louisiana is actually the world's prison capital. It actually incarcerates more people than any other country in the world. At one time, Shreveport was ranked the 12th most dangerous city in the country. And it's said that 1 in 3 black males would go to prison at some time in their lifetime. And I found this to be very true with my immediate family. If you can imagine the prison system here, it's like a rat's wheel where it's a continual cycle of in and out of prison, out, in, out. Starting with my dad when he was younger, he joined a gang, sold drugs, used drugs, but eventually turned his life around, became a minister. My mom, ever since I was young, she's probably been in and out of jail maybe 30, 40 times, in and out of the hospital. About a year ago, I received a phone call, and whenever I receive a phone call from someone that is close to my mom, I'm always worried to get that phone call, like, wow, she's been missing for a few days, or she, dealing drugs again, or using drugs again. But I got this phone call maybe a year ago that my mom was shot, and she's actually paralyzed from her waist down due to her drug addiction. My little sister did time in prison, 3 years in prison. And then my little brother, he was sentenced to a juvenile life sentence for armed robbery. And then there's me who, going down a path of hanging out with the wrong people and, finding myself in situations that I had no business being in and, pretty close to going down that same path. At one point, there was 3 out of 6 members of my family that were in prison all at the same time, but for different reasons. So my greatest fear growing up here was that I would become a statistic. Like I said, I had family members, close friends. My cousin, who I grew up with, who's like my best friend, he's in prison. He's completing a 3-year prison sentence, and he's getting out in a few months. But I made a vow to try to avoid this generational trap. And people always ask me, what was it about you? How did you avoid, you had all of your family members go to prison. How did you avoid, going to prison? It was a couple of things. One was my dad, who turned his life around, became a minister. And I remember going out to the streets of Louisiana, different neighborhoods. We would hand out pamphlets and we would minister to people and hand them food. So that altruistic, mentality kind of stuck with me through medicine. And then this Medical Careers Magnet program that introduced medicine to me is the reason why I'm a doctor today. And then my older brother, who's here, he is in the Army. He's been in the Army active duty for 24 years. His unit's actually about to deploy to Iraq. And I always looked up to him because he kind of stayed astray too, stayed out of trouble mostly. And then, but he was a good role model for me growing up. Another way that I kind of avoided becoming a statistic, I joined the Air Force at age 17. And this took me to Balad, Iraq, which is right outside of Baghdad. I joined at age 17, served 8 years, and then spent 5 months over in Iraq. While on active duty, I went to school at nighttime, weekends, internet courses, wherever I could take classes. And it took me almost 7 years to finish my degree because of the military requirements, having to drop classes. The military wants you to be all about military and kind of things that you do outside of that. It's your own military time. But finally finished and graduated from UTSA in 2007. So this is in Balad, which was a place called Mortarville because we got shot at with mortars multiple times per day. We had to take guard duty. And then this was a injured soldier that we were loading onto the chopper to get him to Germany for further care. This is where we worked out of here. This is our called tent city. I was part of a team that we could go anywhere in the world and set up a fully functional hospital within 24 hours. We can set up an ICU, a small entrance for the ER, a ward section. And whenever we got shot at, we would go in these little bunkers right here to kind of hide out. And until we were given all clear, we put our Kevlar vest on, grab our weapon, and go into here. And then other guys would take care of the bad guys. This is just a picture of where we lived for a couple months. And this is what it looked like inside of our hospital here. Mostly these were Iraqi patients who were involved in gunshot wounds, blast injuries, suicide bombers. There was all different types of patients, and we took care of them in this little area right here. This was the ward. What I had a hard time, dealing with was the fact that we had to take care of the prisoners of war as well. So we would capture one of the Iraqi prisoners of war. They would be pretty close to the American soldier that they just shot. So that was pretty, difficult to kind of grasp and understand at first. But that's what we had to do. This is over Baghdad right here. And you guys see anything in this picture here? Well, those guys see you. There's those snipers right there. These are the guys that took care of us and made sure that we were safe when we were out there because the enemy was not too far away. They were just over here in this little village, and they would sometimes injure themselves just to get into our compound. They would get coordinates to our compound, go back and tell their friends, and then shoot their rockets at us. So these are the things that they shot at us here, rocket-propelled grenades. It was said that our unit survived over 100 of these attacks here. And there was one that came very close to, I'm pretty sure if this would have hit or detonated, I probably wouldn't be here today, but I was taking care of a wounded soldier one day, and I heard something go over my head, and it was like, shoo, I hit the ground. Coming to find out, they were getting pretty close to hitting us, and what the RPG is actually a dud. So the explosive ordnance team had to come out and detonate this, but if this would have went off, it probably took out our whole compound. So when I talk to students, I always talk about the paths that I take or that you can take to reach your goals. And along this path to become a surgeon, I was an EMTB in the military, critical care technician, LVN, medical student, orthopedic surgeon, orthopedic spine surgeon. I always talk about my path. Got out the military in 2007 and started applying to medical school. And I thought that my real world experience, everything that I had been through growing up in Louisiana, that would hold some weight, but I was actually in for a rude awakening because I applied to medical school 2007, 2008, 2009. And each year, there was a rejection after rejections that came in. And I keep some of these emails here just, look back on and remind me and keep me humbled about, the path, that is taken to get to this point. These are schools that I applied to. You can see here, 2009 and 2010, Tulane sent me some rejection letters. And it wasn't until I came across a post-bac program at Georgetown. It's called the GEMS program. And this is a program that prepares students from disadvantaged communities to go into medicine. They teach you how to study, how to take tests, how to excel, in medical school. And I give this program credit for allowing me or giving me the opportunity to become a doctor. As you guys know, medical school is really competitive. The first 2 years are classroom. Third and fourth years, you're in the hospital doing rotations, and then you do your residency. My fourth year of medical school, I was actually fortunate to go to Liberia, West Africa. I went with one of my classmates who is actually from there. We went to JFK Hospital, and that was really a life-changing event. The food was really good, and this was outside of the surgical unit here at the JFK Hospital. And I was just taken aback by that these people, even though they didn't have, the best technology, all of the, the instruments that we use in surgery here, but they were still happy and they were doing what they can with what they had. And this was, I remember from my anesthesiology rotation, I don't think we use halothane anymore. You still use it? Okay. Haiti, okay. But this was, we were rounding on a patient, and this window here, the hospital didn't have any air conditioning. This window was the only source of kind of air that circulated through the hospital. We took care of a lot of different injuries, patients who had infections, osteomyelitis. A patient back here had TB. This patient, I did a completion amputation for gangrene of the lower extremity. And really, injuries and different diseases that you just wouldn't see here or not as common in the U.S. When we got to Liberia, what I didn't know that there was an Ebola outbreak that was about to happen. We got into country and people were running around in the hospital and they were saying, hey, Ebola's coming, Ebola's coming. I was like, what's that? So come to find out that this was only the beginning of a, years-long, devastation that kind of devastated the country. The CDC actually came over and gave us a lecture how to properly gown your mask, your gown, and it was pretty disheartening to come back to find out that some of the doctors that I worked with there passed away a few months after I left. This is Dr. Brisbane. The story that I remember about him, I was working in the ER, and when I went in to introduce myself, I said, hey, I'm a fourth-year medical student. I'm here to help you out today. He said, okay. He shook my hand, and he left. I don't know where he went. But as soon as he left, I thought like everything went downhill. Patients started coding, first time intubating somebody by myself, chest compressions, giving the medications. It was a complete mess. And unfortunately, he passed away from Ebola, but Dr. Brisbane was one of the ER doctors there. This is Dr. Boer. He was the internal medicine doctor and chief medical officer. He passed away, as well as some of the residents that I worked with there. I was able to go speak to some of the students there and tell my story and give some advice to them. We did some dental hygiene kind of care. And I saw some of the students over in the corner kind of giggling. And I was like, what are you guys laughing at? And I was like, your lips are really pink. So they took, thought that was pretty funny. So residency, you apply during your fourth year, as you guys most likely know. It can range from 3 to 8 years. Being a resident means to reside. So you're going to spend a lot of time in the hospital. How many medical students do we have? Wow, good. So it's a fun time because you're actually doing what you signed up for. I love, operating. I love surgery. And even though, it's a lot of hours, you get to help patients at their lowest points of their life. And it's one of the greatest things ever. So when you're choosing a residency program, how do you choose? And one of my professors in medical school said that you have to look at 4 things: money, passion, lifestyle, or prestige. If you choose a specialty that makes a lot of money, like neurosurgery, well, your lifestyle may be affected by that. If you choose something for the lifestyle, family medicine or pediatrics, well, your pay is going to be affected by that. So you have to determine what matters most to you. And for me, it was passion. Very passionate about helping patients, and I love the immediate gratification that we get in orthopedic surgery. So the match process, how do you do well? Well, I need to update this because now in the next 2 years, the step 1 is going to be pass or fail. But clinical grades, letters of recommendation, those are things that are important that the program directors look at when trying to decide an applicant. And when you're trying to choose, if you guys don't know what you want to go into yet, you can use this chart here. You ask yourself, what is the problem? If you don't like anything, your grades are okay. Are you a huge nerd? What do you think of kids? Okay, you love them, you go into pediatrics. If you like them asleep, you go into anesthesiology. If you think kids smell, what do you think about sleep? Sleep is for the weak. Do people say meow when they see you? OBGYN. I don't know what this means. What do you enjoy in your free time? It says strip clubs for orthopedics. I don't know what that means. So in my 3rd and 4th year of being a resident, I was able to go to Haiti, Port-au-Prince, Dr. Chandler's hometown. And I went with Dr. Wilkins, who's a pediatric orthopedic surgeon, as well as a veterinarian. And he's been over there probably about 50 times in the last 20 years. So he invited me on 2 separate occasions. We went to a hospital there to do orthopedic trauma and general surgery. And this was the kind of, when I first walked into the hospital, the type of environment, the beds overcrowded, patients laying on top of one another. At one time we ran out of oxygen and we couldn't do any cases because of that. And then the operating rooms, which were pretty busy. A lot of general surgery residents came in to observe some of the procedures that we were doing. We put an external fixator, which is a metal device to stabilize the bone. We put on this little kid who had osteomyelitis from an open fracture that occurred a few months back and got infected. And then, like I said, there was no AC in the hospital, so this can get pretty humid in the operating rooms. A similar kind of setup and situation as it was in Liberia. When I was scrubbing my hands with Dr. Wilkins, I was looking for one of the scrub brushes, and he was like, this is the only one we have. So we actually, unfortunately, had to use the same scrub brush. But what I took away from that is that you have to improvise, and I recommend and challenge, if any of you have an opportunity to go on an international trip, I would say do that. These are some of the injuries, pediatric fractures of the femur. Here in the U.S., this kid, depending on their age, could say spica cast or intramedullary nails. But in this location in Haiti, most of these patients will be put in traction for months at a time or for weeks until this heals. So they're in the hospital during that time. This was different tumors that we see, patients who have different fractures here that get left untreated, unfortunately. This was a young kid that I really was inspired by this kid. I saw him in the emergency room, and he presented with this here. Does anybody have an idea what that is, medical student? There you go. So this kid presented with osteosarcoma. Unfortunately, this is something that no oncologists or treatment centers that are able to take care of him. He was very anemic, and I asked him. I said, "Hey, man, are you scared? How are you doing?" He basically said no. He sounded very confident too, knowing that this kid would probably succumb to this disease, something in the U.S. that can be treatable. Speaking about spica casts, we had spica tables here, or fracture tables to put these little casts on these patients who have fractures. I had to hold this little kid up. You can see he wasn't pretty happy about that. And we saw a lot of patients with club feet, and they did a pretty good job about managing these patients with serial Ponseti casting. So I was able to go to another school there for the deaf. These kids were all deaf, and they communicated with sign language, and they were pretty happy that we were able to go out and visit them. As you guys can see, I love to travel. So I went to Thailand, my last fourth year of orthopedic residency. I received a trauma fellowship to go there to do trauma. I was there for a month at this hospital here. And they have a pretty similar residency program as we do here in the U.S. They have weekly and daily schedules in terms of their lectures. But what I found that was most shocking is that a lot of these people drove these little bikes to work here. And this was the big mechanism of injury for a lot of these patients. We saw a lot of femur fractures, patients who had distal radius fractures, tibia fractures. There were some spine surgeons that were there. I was able to do some spine cases. You can see here a lot of stenosis, which means tightening of the spinal cord and the roots there. Big scoliosis cases. So they were pretty developed as a medical entity, and they were doing some pretty complex cases. One thing that I thought I had to get used to was this here. In the operating room, here in the U.S., we wear, shoes with socks. They don't do that there. I guess that's their tradition to not wear any socks and just sandals. And I couldn't take the opportunity. I wanted to take the opportunity to participate in this too, so I made sure that those shoes were really small. People called me Will Smith when I was there, LeBron James. You imagine being in Thailand, 6'4", and then among, everyone else who's really short. But, they had a pretty good residency program, but a lot of times the cases were over-scrubbed. Here in the U.S., you won't see 8 people scrubbed into a case. General surgery or ortho residents, staff, scrub techs, 3 scrub techs. These sales reps actually scrub into the case as well. Here in the U.S., they tell us about our implants, which way they should go, what screw sizes we have available, but they scrub into the cases there. And they were doing arthroscopy, ACL repairs, the whole run. And this was the first place I was able to actually go scuba diving, so I thought that was my favorite part of the non-medical aspect of being there. So you guys know what orthopedic surgeon is. Surgeons who we treat disorders of the bone, ligaments, tendons, muscle, aka the bone doctors. And do you guys know how much orthopedics on average makes? Yeah, about 400 or so. But it ranges depending on your academic, private practice. A lot of different variables that go into that. So the training, it's 5 years. You do an additional year fellowship, which is optional, but 90% of people do a fellowship in either pediatrics, sports medicine, oncology, joint replacement, foot and ankle, a lot of different options. It is the best specialty out there. You'll hear people talk about their specialty and say, oh, nephrology is the best specialty, or ENT, but orthopedics is the best. Sports medicine, you can work with NFL teams, high school teams, different basketball, football, the whole works. I was able to go to some of the Spurs games during the playoffs when David Lee got hurt. One of my friends caught me on ESPN, kind of walking him back to the locker room. And then we fix a lot of different injuries, like RG3, who tore his ACL, or Paul George, who suffered this tibia fracture here. I see some people they don't like that. But this is a typical fracture that we treat in trauma, and I know here in Shreveport there's a lot of injuries like this that are treated with the intramedullary nail, which is a metal rod that goes on the inside of the bone. Different fractures of the distal radius. You can do joint replacement, which is hip and knee surgery. We wear these spacesuits here in surgery to kind of protect us from the body fluids. And this is kind of the knee implants, or one particular knee implant that we can use in surgery. Foot and ankle, which you treat a lot of disorders of the foot. You work closely with different services in terms of plastics and different consulting services to take care of these patients with these injuries. But spine surgery is the best, and I chose spine because I've always liked the brain and spinal cord. I like the technically challenge aspect of it. You know, you're putting screws within millimeters of the spinal cord, and you're decompressing patients with their cervical spine. And if you plunge too hard, or if you're just, a little bit pressure too hard, you could actually injure a patient or paralyze a patient. So the stakes are really high, but the technology is probably one of the most technologically advanced fields out there, if I had to say. This is a intraoperative O-arm here, is a big CT scan intraop that we can get while the patient's asleep to assist us in placing, screws and different hardware within the spine. Robotics in spine is a big these days, where we use a robot. I can plan before the patient even goes to surgery. I can tell the robot where to put the screw at, what angle to put the screw, what size screw. And all I got to do is tell the rep to, hey, send the robot to L4 on the right side. It will take it there. Then you just put your screw in. You don't have to take multiple x-rays, big dissections where patients don't do as well. This is one case that we did maybe a few months back, a patient who presented with this, and we took him to surgery. We put rods, screws, and cement to kind of augment his bone. His bone wasn't the best. And this is just the robotic arm here that we use in surgery. There's also intraoperative navigation, where we can look at live feedback. The surgeon's looking at this monitor here. You can place the screw using the navigation. Knee replacements, hip replacements, those other services use this as well. So when I talk to students, I always tell them, I think about what is it that I would want to, people that are coming behind me, what can I tell them? What was it about me that I did differently? How did I avoid becoming a statistic? And what advice can I, embark on the next generation of doctors and future healthcare leaders? And I always tell people that the number one thing is to believe in yourself. There's going to be people along the way that tell you that you can't become a doctor, or you can't become this, you can't become that. But those people told me the same thing. Kobe Bryant, rest in peace, probably arguably one of the best basketball players that are out there. He stated that if you don't believe in yourself, no one will. And I've always admired his work ethic over the years. Even though he's reached that level of success in the NBA, he carried himself as if he didn't have that much success. 4 a.m. workouts, or shooting around after a game, still trying to perfect his craft. And if you want to be successful in any aspect of life, you have to do things like this here. And I always compare Kobe Bryant or Michael Jordan or any other athletes out there that you have to have that same mentality. And that's the approach that I've taken over the years. In medical school, if my classmates would have read a chapter 2 times, I would have read that same chapter 7 times, 8 times. If they did 500 questions for an exam, I did 2,000 or 3,000 questions, essentially outworking everyone else. So just remember to have that mentality, and also to believe in yourself. The second thing that I think is important is to surround yourself with positive people. And growing up here in Louisiana, I started hanging out with people who, weren't up to any good, and, started getting into trouble because of that. So I always try to encourage students to seek out mentors. I didn't get to this point, by myself. There's been people along this way that, that someone that I can relate to. And I didn't know any black doctors kind of growing up. So it was really inspiring to see the people that were in spine, like Dr. my friend here and Dr. McCormick and Dr. Minga, who are both spine surgeons, as well as Dr. Kayanja, and he's a plastic surgeon who I look up to, and these people kind of encourage me along the way. This is another one of my friends who's a spine surgeon in San Antonio, and he is partially one of the reasons why I went into spine, because I always tell people that you can't become something that you don't see. So find someone that you can relate to, that you can bounce off ideas, that you can mentor you along this process. This was a cadaver course a few months back, and I was inspired that these guys looked like me, and these are all spine surgeons here, and I was really inspired by that. So that's why it's really important that you surround yourself with positive people that that looks like you. This is a group of medical students, a program called the Nth Dimensions. This is a program that encourages minorities and tries to increase diversity within medicine. And this is the type of people that you want to associate with, especially if you want to go into a particular field. So find someone that that you can relate to. And the last thing is to never give up. Michael Jordan said, "I can accept failure. Everyone fails at something, but I can't accept not trying." And all along this journey, coming from Shreveport to having multiple family members that were in prison, and then still trying to tell myself to keep going despite the rejections, the people telling me that I wasn't going to make it. I relied on people like this to inspire me, to use them from the encouragement to keep going. One of my professors in medical school stated that failure is not in the falling down, it's in the failure to get back up and try again. And all of my life, I've tried to live by that same philosophy. So thank you guys so much. So this is medical director at NBC, Dr. Pryor, who's nice enough to read my book and wrote this. This was a medical student in South America who ordered my book, and I think she wants to become a surgeon. I was just really inspired by that. The internet, social media these days is really powerful. You can, put up a post and inspire somebody all across the world in a short amount of time. This is Tom Joyner, Tom Joyner Morning Show, and I'm not sure if you guys are old enough to watch Living Color, Tommy Davidson, but and this is my beautiful wife, my little son Austin, and who's 7 months, and my son Caden, who just turned 9. Yeah, and I would like to, Mr. Hooks, you can stand up, please. This is my principal from middle school here at this is the guy I told you he spanked me when I was younger. But people like him, who was that other father figure in my life. My dad, had my siblings and I by himself when my mom was off using drugs and doing things like that. But he kept me in line, and other kind of people that constantly looked after me and made sure that I was successful. So, every talk that I give here in Shreveport, he's up on the front row and here. He was here this morning at 9 a.m. Just want to say thank you again.
But now I'm taking time for me. Can't nobody grind for me. The hardest blow won't ever take me down. Yeah. The strongest thief won't ever take my crown. Yeah. Held down for so many for so long. But now I'm taking time for me. Can't nobody grind for me. Yeah.